and welcome to another edition of Health Focus on GhanaWeb TV with me, Stella J. Johnson. Today we are putting into focus HIV/AIDS because AIDS has become a phenomenon that is affecting a lot of people in Ghana and even on a larger scale, that's the world at large. Today we are going to talk about how you can avoid contracting AIDS, and even when you do, what you can do to be able to stay still healthy and live a normal and a happy life. Today I'm joined by Mr. Ernest Amwabeng Otsen. He is the president of the Ghana HIV and AIDS Network. So today on Health Focus, be sure to expect that we are going to talk about what HIV and AIDS is for people who know and may have forgotten some of the signs and symptoms that you would have to look out for if you have like any problem at all, because sometimes AIDS and other sicknesses may have the same signs and symptoms. I'm not an expert, I'm just your host, and so I'll now take it to my expert so that we delve more into the conversation. Hello, Mr. Amwabeng Otsen.
Hi.
My name is Stella.
Stella.
Yes.
I hope you're doing well.
I'm very well, and
good.
you?
I'm also
Thank
fine.
you so much for joining us today. So, first of all, to set the ground ruling, what is HIV and what is AIDS? Are they the same, or they are two different entities on their own?
Well, thank you very much, and I'm happy you are starting with this question because most of the time people confuse the two and they think they are the same. No, they are not the same. Okay. HIV, as the acronym stands for, is Human Immunodeficiency Virus.
Okay.
Human Immunodeficiency Virus. And then AIDS is Acquired Immune Deficiency Syndrome. So here's the difference. When someone gets HIV, they have only gotten the virus.
Okay.
That can potentially lead to AIDS, but not at the AIDS stage yet.
Okay.
So when you get the virus, you may live your life very normal without showing any signs and symptoms.
Okay.
When you get to the AIDS stage, that is where you experience the syndrome. The syndrome simply meaning that different diseases affecting you at the same time. That's a syndrome.
Okay.
So when somebody gets HIV and the virus is not treated, it gets to a stage where the person's immune system becomes very weak. And at that stage, different types of diseases that we call opportunistic infections now begin to affect the individual.
Okay.
So the person will be getting diseases like tuberculosis. The person can be getting malaria, severe fever. The person can get shingles. You can get all manner of diarrhea, all manner of sicknesses happening to you at the same time.
Okay.
That is the syndrome. Different kinds of diseases attacking you at the same time. It is at that point that we say you have AIDS.
Okay.
But these days we don't even call it AIDS. These days we call it advanced HIV.
Okay.
So when you don't treat the HIV, it advances and it weakens your immune system.
Okay, that's a new one. Advanced HIV.
Yes.
Okay, so from here, when you have HIV, we are going to now talk about some of the signs and symptoms. But if I'm getting this clear, does HIV have a potential to be cured?
Well, the first case was recorded in 1981.
Okay.
In the US. And here in Ghana, we recorded our first case in 1986.
Yeah.
From the 80s to date, a lot of research has gone on, but none of them has led to a cure yet.
For HIV?
For HIV.
Okay.
So as we speak, there is no cure for HIV. However, there is treatment. Treatment meaning that we can manage the situation. without necessarily eradicating it. So we manage it. And now we have very advanced antiretroviral medications that can help you to manage the situation for the rest of your life.
Okay.
So in Ghana, for example, last year, 2024, we celebrated 20 years of antiretroviral therapy in the country. And I know people who went on treatment as far back as 20 years ago, and they are still alive. A typical example is the president of the network of persons living with HIV. She'll be 70 this year, and she has lived with the virus for more than 30 years.
Wow.
And she's been on treatment since we started treatment here in Ghana. And she's still very much alive. And I personally know people, some 15 years, some 17, 18 years, they are still very much alive and have been on treatment.
Wow.
Yes.
So we are going to talk about treatment. But before that, generally what we know is that HIV, right? I don't even know how to say it. Can I say HIV and AIDS, or can I say AIDS?
No, you can say HIV.
I can say HIV.
Yes.
Okay. So we know that HIV, one of the main modes of transmission is, from, you can get it from an infected person through sexual intercourse and all that. But what are some of the, most prevalent modes of transmission that we've had since when it was
the first case was
detected?
Thank you very much for the question. So in Ghana, we have 4 important, modes, or 4 identified modes of transmission. The very first one is what you mentioned, where one person transmits the virus to the other person through sex.
Okay.
So, sexual intercourse with an infected person, that is the most prevalent mode of transmission. In Ghana, about 80% of all our cases are from sexual intercourse. About 80% of all our cases. The second mode of transmission is from mother to child.
Baby.
Yes. So where a mother is infected and the mother does not go on treatment, there is that potential that the mother can pass on the virus to the child. And in Ghana, about 15% of all our cases are from mother to child.
The rest of the 5%?
The rest of the 5%, sharp objects. Like persons who inject drug.
Okay.
So, sometimes they share the needle in a brotherhood form. This one takes the needle.
Drug abuse.
So this person injects and then gives the syringe so that the other person, and also injects.
People do that?
Yes.
Wow.
So, and then plus the sharing of sharp objects like blade.
Yeah.
We go to the saloon all the time. Clippers are used on our heads. There are these people who go around our various communities, markets, exactly, to do pedicure, manicure, and all of that. And they use unsterilized equipment. So that is also one possible means of getting the
Not
person.
to cut you, but
and
the sterilization.
The final one is blood transfusion, where you get transfused with blood, but then maybe the blood is contaminated.
But wouldn't that count as negligence on part of
men? Yes. In the early days, we used to have a lot of those cases, but now there's vast improvement. So now the blood is tested thoroughly before it is transfused to other persons.
Like I was asking,
yes.
So does sterilization, kill the virus?
Oh yes.
Sterilization of the objects that we use to.
Yes.
So it means that sterilization is something that we have to.
No, we have to take it seriously.
Okay.
Because it's how do I say it? Viruses don't die, so it just weakens the virus and makes them inactive. Let's put it that way. It makes them inactive, so they can not infect you.
Okay. So on that tangent, I was going to ask you this when we talk about treatments, but let me just chip it in now. When you talk about people have had it and they've taken antiretroviral drugs and now they are living
very normal lives. Yes.
Do they still have, does it get to a point where they are no longer able to transmit or infect other people?
That's a very good question. So as part of our campaign, there's something we call U equals U. It's part of our campaign acronyms.
Okay.
Undetectable equals untransmissible.
Okay.
What it simply means is that when somebody goes on treatment and the person stays on treatment, takes the medicine religiously as prescribed by the doctor, not mixing with other things, but stays on medication, within a period of 6 months, maximum 1 year, the person will achieve viral suppression. Viral suppression simply means that it gets to the point where the amount of virus in the person becomes very, very low. Very, very low. And even the ones that are present are inactive.
Okay.
So at that stage, that person cannot pass on the virus to another person.
Okay.
So HIV treatment is seen within the health circles, within the public health strategy, as a prevention method
for transmission. Okay.
Because you have two people. One is positive, one is negative. If the one who is positive goes on treatment, achieves viral suppression, this person will not be able to pass on the virus to the next person. So that is why we have persons we call discordant couples. That is couples who are living together or staying together. One is positive, the other is negative, and yet the one who is negative does not become, infected.
Okay.
And that is because the one with the virus has achieved viral suppression.
Okay. So on that particular tangent, does it mean that you can only the virus can only be transmitted through blood, bodily fluid, saliva, maybe through urine? You go to the washroom, someone has left. Apart from blood, are there other modes of transmission?
Okay. So again, that's a very important question. So apart from blood, the other bodily fluids that can transmit or contain a virus are: one, breast milk. Breast milk can contain the virus. Vaginal fluid can also contain the virus. And then semen can also contain the virus. The rest, like saliva, no. Sweat, no. Urine, no.
Okay.
Fecal matter, no.
Okay, so now it explains to me and gives me a broader picture on why it can be transmitted through sex a lot and from mother to child.
Exactly.
Okay, so now that we've established all that, can we now talk about how you would know that you have HIV?
Okay, so the surest way you can know that you have HIV is through testing.
Okay.
Testing is the surest way by which we can know that someone is HIV positive. Okay. And there are different kinds of tests. These days, we even have self-test kits.
Okay.
And when I was coming to the studio, I came with a sample of a self-test kit.
Okay.
Where you yourself
can test. Okay.
If you don't want to go to a health facility, you yourself, you can
I can test it on my own in my room.
In your room.
So is it available in the pharmacy?
So currently, some pharmacies have stock.
Okay.
But the ones we are promoting now, these are the ones that the Global Fund has bought for Ghana, and so we give them out for free.
Okay.
But there are some pharmacies that have some other variations of the self-test kits.
Okay, so when we will actually test it out. I want to, see
very
how it's done.
Yes. So I'll give you one and you try yourself, or I can explain to you how you go. So testing is one of the
surest ways
you can, know.
Okay.
The other means is that when someone starts showing certain symptoms. Now, I'm going to mention some symptoms, but these symptoms may be common to other health conditions.
Yeah.
So it doesn't mean that if you see these things, then necessarily the person is HIV positive.
Okay.
But clinically, what has been established is that when someone gets the virus, as I mentioned earlier, the person can live on for many years without showing symptoms. Some people can live up to 5 years, 6 years, some up to 10 years and more. And this is because naturally, these people have very strong immune systems.
Okay.
For those with very weak immune system, less than 5 years, let's say 2-3 years, they will start showing the symptoms. So one of the number one symptoms that we have recorded in Ghana is tuberculosis.
Okay.
When people get infected with tuberculosis, there's a likelihood that they may be, infected with HIV as well. So, getting tuberculosis is one of the red flags we look out for. The other one has to do with a sharp loss in weight.
Okay.
Within a very short time, somebody loses weight for inexplicable reasons. The person is eating, doing everything all right, but then for no reason, just keeps on losing weight, keeps on losing weight, keeps on losing weight. When that happens, it's also one of the major symptoms. The other one is fever, malaria, and its associated condition of sweating heavily at night. You will see that the person will be sweating heavily at night. Their clothes will get drenched in sweat, and it keeps on persisting for some time. Another major symptom is diarrhea. The person gets diarrhea, and just for 2 weeks the diarrhea is running non-stop. You take all manner of medications, take antibiotics, take everything, but still the diarrhea is persisting. That's also one of the major symptoms. Then we have oral thrush. Okay. So you see some whitish substances around a person's mouth. Then we have sores in the person's private parts.
Okay.
So you can see some sores, coming up in the person's private parts. Then you have genital warts.
Okay. So warts is like an STI.
Yes, an STI.
But it's also a symptom of HIV.
Yes. Because remember, I told you that when you get the HIV, it weakens your immune system, and it gets to the point where opportunistic infections come into being. So all of these things that I'm mentioning, some of them are some of these opportunistic infections that affect you. So some of the STIs are closely. And that is why when somebody reports an STI in a clinic, most of the time the doctors will do an HIV test. Yes, because it could be an indicator that the person probably has the virus as well. Okay. Then one other important symptom that I need to mention is shingles, what you call in our local parlance anansi.
Okay.
It affects a part of your skin, the skin, and it is believed that if the thing goes round and round,
anansi is a skin condition.
Exactly.
Oh, okay.
Yeah.
Okay.
So it can be here, parts of your body.
When you mentioned anansi, I was thinking of pins and needles.
No,
in your legs.
No.
Okay.
So the skin, condition,
okay.
makes some marks there and all of that. So anansi is also another major symptom of the virus, being present in you. So when you see all of this, or a combination of some of these symptoms, then it is time to visit a doctor
Okay.
and do a test just to be sure.
Right.
Because it could be another condition.
Yeah, I want to join you to emphasize the fact, because some of the things that you mentioned are very common to other medical conditions. For example, tuberculosis on its own, can have like a lot of the symptoms that you have mentioned. That doesn't mean that if you see these symptoms.
So, but what we've seen is that if you look at the number of AIDS deaths, about 15% have tuberculosis.
Okay.
Yeah. So that co-infection, there's a strong linkage between